The number of patients on the NHS waiting lists for diagnostic tests is at its highest level since data collection began. Sue Saville visited Specialist Diagnostic and Treatment Centre Greater Lancashire Hospital to see how an innovative approach is helping local NHS hospitals meet their targets and avoid financial penalties. Like so many parts of the country, Lancashire has an ageing and growing population with pockets of social deprivation. This all adds pressure to NHS services. These work on limited budgets but have constitutional commitments to deliver for patients. So how can those services be delivered?
In our fast-paced society, there's little let-up in the pressure of demands on the NHS. But in Preston, there's a new way of working. This leading GP, with 25 years' experience, is now practising at a private diagnostic and treatment centre, which, he says, acts as a pressure valve to deal with NHS cases which are overburdening local services or likely to overrun maximum waiting times.
NHS organisations are suffering, they are under severe demand, but in particular to this area, I think the growing population and the ethnic diversity poses big challenges to our health economy. Hospitals or NHS organisations are on a timer. We have the 18-week timer. They have to meet the timers, and if they don't, they're breaching their contracts. So if they can find reliable partners like ours who can carry out the work for them in a timely fashion, then it is a win-win situation.
What this points to is a third way. Greater Lancashire Hospital is a privately run facility treating NHS patients for a range of day cases. The hospital is a partnership, bringing the benefits of private healthcare for the same cost or tariff as in the NHS, or for some procedures at a lower price. Top consultants like neurosurgeon Professor Charles Davis are attracted to work at the newly equipped smaller hospital because they can deal with cases speedily in a supportive environment.
If we weren't here, waiting lists would be longer. Patients' operations and investigations would be cancelled. Although this is a smallish facility, the volume going through is high, so it helps the NHS. By taking the elective work away to another efficient facility using NHS tariffs, it takes the pressure off those hospitals.
The founder of Greater Lancashire Hospital, Guam Raja, says the model is to work in partnership with the NHS rather than competing for patients. They already have contracts with leading local teaching hospitals.
We're not in competition with the acute trust. We work closely with them. We understand the pressure they're under. We also work with the commissioning group. These are the commissioners of health, identifying areas of pressure. We work in collaboration, able to pick up some of the work that hitherto cannot be done, or they haven't got the space to do it.
The range of specialities offered here is growing. The emphasis is on investigation, diagnosis and treatment in the community. Consultants speak of a return to closer relationships with GPs, as well as the streamlining of the patient pathway.
The beauty of the Greater Lancashire Hospital is that we've been able to have a collaboration between the management and the ownership here and the surgeons. And we can offer wonderful one-stop facilities for patients with diagnostic issues. We can diagnose problems and treat them medically, or if they need something more complex doing, then they can then be returned back to the trust for further intervention.
Being CQC registered, indemnified by the NHS Litigation Authority and operating on the secured internal N3 connection, Greater Lancashire Hospital works within the NHS, helping trusts keep to waiting times by taking some of the strain from their services.